Assalamualaikum everyone, welcome back to my YouTube channel. In this video we will talk about first of all about nomenclature. Nomenclature of neoplasia as well as carcinoma. So nomenclature literally means new growth. When we nomenclature in the word is neoplasia. The word neoplasia literally means new growth. Neoplastic cells are said to be transformed because they continue to replicate, apparently oblivious to the regulatory influences that control normal cells. Neoplasms therefore enjoy a degree of autonomy and tend to increase in size regardless of their local environment. Their autonomy is by no means complete, however. All neoplasms depend on the host for their nutrition and blood supply. Neoplasm derived from the hormone responsive tissue often also require endocrine support, and such dependencies sometimes can be exploited therapeutically. In common medical usage, a neoplasm often is referred to as a tumor, and the study of tumor is called oncology. From oncus means tumor and logos means study of. Among tumors, the division of the neoplasm in the benign and malignant categories is based on the judgment of the tumor's potential clinical behavior. A tumor is said to be benign when its microscopic and gross characteristics are considered to be relatively innocent, implying that it will be remain localized and is amenable to local surgical removal. Affected patients generally survive. Of note, however, can produce more than localized lumps, and sometimes they produce significant morbidity or they are lethal. And the second one is applied to a neoplasm implies that can invade and destroy the adjacent structures and can cause death. And Latin word for crab, and this is adhered to any part and can that they size in an obstinate manner similar to the crab behavior. Not all cancers pursue so deadly a course. The most aggressive are also some of the most curable, but the designation malignant constitute a red flag. Here is two basic components. First one is parenchyma and second one is host-derived stroma. The parenchyma is made up of transformed or nucleoplastic cells, and the supporting host-derived neoplastic stroma made up of connective tissue, blood vessels, and host-derived inflammatory cells. The parenchyma of neoplasm largely determines its biological behavior, and it is component from which the tumor derives its name. The stroma is crucial to the growth of the neoplasm since it carries the blood supply and provides the support of the growth of the parenchymal cells. Also, the biological behavior of tumor largely reflect the behavior of parenchymal cells. That has been a growing realization that stroma cells are neoplastic cell carry on two-way conversation that influence the growth of tumor. Now we will talk about cancer is the second leading cause of death in the United States. Only cardiovascular diseases accept a higher toll. Even more agonizing than the associated mortality is emotional and physiological suffering inflicted by neoplasm. Patient and public often ask when will there be a cure for cancer. The answer of the simplest question is difficult, because cancer is not one disease but rather than many disorders that share a profound growth dysregulations. Some cancers such as Hodgkin lymphoma are highly curable, whereas the others such as cancer of pancreas are usually always fatal. The only hope for controlling cancer lies in learning more about its pathogenesis, and great study strides have been made in understanding the molecular basis of cancer. The chapter lead with the basic biology of neoplasia, the nature of their transformation and host response. So if you like our video, please don't forget to subscribe the channel, and thank you so much for watching the video.